So hi, this is Mary Kurek, and I'm with Frontrunners Innovate Magazine, and I have Laura Hoemeke with me, and we're doing an advisor interview for innovators in spaces that are interested in getting their product or service into, say, third world countries, marginalized communities, government entities. This is where Laura lives. This is in her space. She is a private consultant. Would you like to tell us the name of the consultancy, Laura?
Sure, Mary. Thanks so much. Well, right now I live at my home, like so many of you.
Yes.
I have a consulting firm called Hoemeke Global.
Okay. I'm going to ask you a little more about that in a minute, but everything that we were talking about just before we got on to the recording has brought me back to Switchpoint, which is a conference that's put on by IntraHealth, which you know very much about because you were involved in all of that when you were working at IntraHealth. But you know, ramp it up a few years, and you've been working on projects for the World Health Organization, the World Bank, the Bill and Melinda Gates Foundation. You've got clients that, you know, UN, that go everywhere, to every nook and cranny of the world, that are working on a lot of women's health and maternal types of projects. So I did notice that. And we've got an edition of the magazine coming up on those types of subjects. So this will be, I may be back at you. This will be interesting.
Yes, absolutely.
But wanted to give you an opportunity to tell me, so when a client comes to you, or when you're aware of a client that you need to work with, what is it they're looking for from you? What is it what service are you providing for them?
Thanks so much. I always love talking about global health and public health in general. And I mean, this is a moment of global health. So in general, when clients come to me, I have kind of two different ways of working. Sometimes it is a very specific request and a scope of work is written, and they kind of, it's a great match with my background. And sometimes it evolves, and it's more kind of, what can this relationship look like? And I love to, I mean, my background is really public health and global health. I think I'm really fortunate because I spent about 15 years living and working out of the US, primarily in Africa, Francophone countries in Africa. So working at various levels in healthcare systems, you know, working directly with frontline health workers, working with ministries of health, with country offices. And then about 10 years ago, kind of did a switch and said, I really want to look more at what impact can I have? All of us working in public health, especially, want to contribute something good. And that's when I decided to come back and do my doctorate and study more sort of the policy angle. So I think having that like background of really what does it take to get things done on the ground, but then understanding how to help governments sort of look at the policy structure, ensure that we have enabling policies to meet our health goals that we want to meet. So it's kind of twofold. Like the Gates Foundation is a great example. I mean, I count my lucky stars because we talked about Switchpoint, which is such a great networking event. There's some connection there to actually the work I have now with Gates, which was being at another conference and running into colleagues from the foundation. And it was just one of those matches made in heaven where they were looking for somebody with experience in Francophone Africa, you know, needed to speak French, you needed to understand how health systems work, needed to have some contacts with governments as well as some of the donors. And you mentioned World Health Organization and other UN bodies. So I really wanted somebody who could work at that country level, but also work with donors. So I'm actually working directly with ministries of health and helping them design projects to reduce maternal and child morbidity and mortality. So at first it was a lot of travel to these countries. In the last 3 months, it's been a lot of WhatsApp calls and Zoom meetings and everything in between. But it's pretty amazing that I can do it from sitting here in my house in North Carolina right now. And then another kind of angle of my business is what we call advocacy, which is really looking at especially policy advocacy. What needs to change in order to make, we can use an innovations example. We all have, you know, I know you work with a lot of innovators, but what's the policy environment that maybe could facilitate the innovation coming to life or be a barrier? So I've done some advocacy work with various organizations looking at sort of the policy structure. And I don't mean to be too vague. One organization I work with is called the G4 Alliance, which is the Global Alliance for Surgery, Obstetrics, Traumatology, and Anesthesiology. Whoa, it's a mouthful, but you know, working with them, 5 billion people, almost half the world's population lack access to really basic surgery. It's something we take for granted, I think, in the US. But really looking at, we're not advocating for more surgery. I think that's a good use. But how can we help ministries of health figure it out so that all levels of care can respond to a trauma, an accident, can provide, you know, basic obstetrics. But anyway, I can go on and on about any of those clients, but I really adapt my approach to what they're looking for.
Well, you know, it all comes down to money, I think, for a lot of them. But then there's a finite amount of that around for a lot of these government entities out there. So when you're designing a solution or helping, you know, a government entity design a solution, or some other NGO, because I know you work with NGOs around the world too. What is the first thing you take into account? I mean, if you're looking for a solution, are you looking for an innovative solution that maybe can encompass the budget that you're trying to apply it to? Or tell me what you're looking for.
Yeah, well, as you know, the Gates Foundation is like the king of innovations. And but what it really comes down to, and I think where some people miss it, is that we really talk about a country-driven approach now.
Okay.
And it's different than when I started working in global health 20 years ago, when, you know, we'd come kind of with a solution. Like, we know that too many kids are dying from diarrheal disease for want of vaccines, etc. So we come and say, here's the solution. Would I advise anyone trying to get into the space, even with innovations, it's like, what already exists? Relationships are so important with ministries of health and other government decision-making bodies. I spend a lot of time doing the unglamorous work of reading everything that exists. So I really have an understanding of what strategies exist in the country. What was tried before and didn't work, or worked, but then ran out of funding. So I think really understanding as much as I can and talking to as many people as I can to get different perspectives on what's going on, what a culture of a ministry of health is. Every country has a different culture, every ministry of health. Every donor has its own culture.
There goes that next question.
Right. So it's really, it's interesting to me, people who say they get bored, especially right now, because there's nothing to do, but there's so much to do. And there's always so much to read, and we're so fortunate now that there's so many resources available online. LinkedIn itself is a great resource. I could get lost on LinkedIn for hours, and but again, back to and all my Ministry of Health colleagues around the world are on LinkedIn too now, and sometimes that's how I make a contact, and then we become colleagues and friends. So it's pretty amazing time we're living in. But I think as far as the donors and innovation, I've been able to be on a few committees in times of COVID that are kind of a quick turnaround for, let's look for an innovative solution to let's have, testing or communications or whatever. I think the biggest challenge I found is some people applying for these kind of innovation grants get kind of swept away with their ideas, which are really cool. And I've seen some amazing videos, but I have, as a judge, I have to go back and look at the criteria and the instructions. And I think some people get so caught up that they forget to go back and look at what was asked for.
Yeah.
And it's like they're so close, but if they've read it again, so just like what is the donor asking for? What is the government asking for? And make sure that it's really responsive to that. And then you can make it exciting and innovative. But
You know, that, and it's the same thing as if you're looking for a job, is paying attention to the details of what that
Right,
description is, instead of trying to
right.
promote from this way out, promote
Yeah,
from that way back, you know,
exactly, right.
is really interesting. In fact, an investor I had interviewed not long ago, I asked him, I said, what is missing in pitch decks that you're seeing? Because he likes to invest in health technology. And he says it's not really that. It's the perspective of the innovator trying to be a salesman instead of trying to be an innovator. And so
Right,
they're trying too hard to sell. So I think that's
right.
kind of a perspective. Well, yeah, I'm going to ask that question anyway about municipalities, as I mentioned, which is governments, different
Yeah.
levels of government that I know a lot of the innovators want to get into. Is there I'm going to ask it backwards. Instead of what are they looking for, is something that would be a hard stop for anybody moving forward in, say, African countries? Because I know you spend a lot of time there.
Right.
Um,
Well, it's hard, and politics always come into play in every country, right? I think, like I said, it's back to that country-driven approach, and it doesn't mean that there's one voice speaking for the country, but increasingly, and it's a really good thing, donors like the Gates Foundation, U.S. government, uh, want to make sure that what we're proposing or what we're funding actually is in line with and will be supported by the government and by what we call domestic resources. So there has to be a nice match, and
By
I think
domestic
yeah,
resources, are you talking about localized NGOs inside the country?
well, or what's the government's budget? I mean,
Okay.
increasingly, some of low income countries are becoming middle income countries. And there
Mm.
are other ways within governments for looking for resources. I mean, some of the work I've done with Gates and others is looking even at what's the role of a mayor. And mayors actually in many countries, especially now as we have more decentralization of the health system and other health systems, locally elected mayors play a really important role. And often they're responsible actually for setting their own budgets and figuring out the tax structure. And mayors can be great allies because then you're not going necessarily to the national level, but you may be looking at a community and how can I support this municipality in functioning better? And some donors are actually also going straight to mayors of districts and of cities saying, can we work together? Yeah, it's really
Fantastic
fascinating.
tip. So instead of trying to go at the highest level, then maybe even going at a smaller area and looking for a mayor that is maybe forward thinking, hopefully.
Yeah. Oh,
Yeah.
exactly. The Gates Foundation is doing a lot of work, even in looking at family planning in West Africa and what's the role of mayors.
Very good. Well, any other last tip that you would have for somebody who is innovating something that was really aimed at those types of countries?
Yeah, well, like I said, there's so much background information that I think sometimes people kind of skip over.
Mhm.
So it's really like,
They need to know
and
where
again,
they're aiming.
yeah,
Right.
it's not the glamorous work, but it's really like, you know, I'd never worked in Mozambique until a few months ago, and it's a wonderful place. I learned I was going to go there for a week in December, so I really, really put in a lot of homework before I even got on the plane to talk to people. Again, scanned my LinkedIn network. Who knows anyone in Mozambique? Who can I talk to?
That's
It's
great.
always more fun to talk to people than read
Yeah,
policy documents,
much
right?
better. Yeah.
But then, I had my airplane reading, and by the time I got there, I felt like, okay, I have a good understanding. I mean, what's hard now in times of COVID is I would have gone back there probably a couple times in the last few months to continue working on this project. And it's because it's so much as relationships. It really is. And so I guess, I mean, a lot of us talked about, the problem even with the term social distancing.
Yeah.
And now's the time not to socially distant, but physically, yes, maybe, but like dig in. And I would also, my advice, I guess, to people would don't be afraid of contacting somebody. of reaching out, of doing that cold call. I would love to chat with you. Do you have 20 minutes? Because you never know. You might get 2 responses for every 10 you send out. But you got to just, be ready for that. And then that one that sticks can change your life. And I would say too, I think it's hard for people now, but I don't lose the excitement for what you really are passionate about. I think that's what you and I were talking about. That's what gets people. That's the hook. It's like your passion for what you believe this can make a difference. And
that most innovators have.
Yes, exactly.
It's their baby, and that's what they're doing. So this is fantastic, Laura. I appreciate this so much. We could go on for another hour.
I know. I feel like we could, Mary. Let's do
this is fantastic. So I so much appreciate this, and I look forward to seeing if there's another occasion that we might pop you on and talk more specifically about some areas in, say, maternal health and that kind of thing.
Yeah, that would be great. Would love to follow.
I'd love that. So thank you again. Good luck. And everybody, Laura will make sure we have your contact information, your LinkedIn profile rather, and your website information. And so if anybody has any other questions, they can contact you.
Great to meet you. Thank you, Mary.
Thank you. All righty.